Thank you very much, George. I have to thank the president of Athanasiou, Dr. Boletis, who is very supportive in the work, especially for interventional cardiology, but in the whole hospital as well. So this is a very small introduction. Sorry about that. I didn't expect that. So it's a very small introduction to facilitate the discussion, which it should be in both English and in Greek for the speakers that they don't want to talk in English because it's the economic approach of our hospital and the health paper to treat these patients. So these patients need to undergo new procedures, maybe expensive procedures, or some of these procedures are currently under investigation, and the hospital tries to implement these therapies. So just a small note in the work that we are doing in Athanasiou, the more than 200 cases, 200,000 cases have been treated in the last 20 years in the cath lab, both by electrophysiology and the majority by interventional cardiology. And the structural heart program has treated more than 1,700 patients with MitraClip, TriClip, LAAO, TTVR, and TMVR. But the majority of these cases, of course, is TAVI, more than 1,600. So it's the largest program in Greece. And the last few years, we try to have a 20% increase each year on the previous number in order to accommodate the market need, because we know that there is still there's a lot of untreated population, and we know that for 1 million population, you expect approximately 220 to 250 patients per year. So that makes 2,200 to 2,500 cases per year of TAVI in Greece. So now we are reaching this number slowly, and I think that the next 3 years we will reach the roof of the market dynamic in Greece. So now in Athanasiou, we are the trajectory that we have this year is 320 cases out of the 1,600 cases. And we have a trajectory for another 20% increase when we have a new hybrid room dedicated to this procedure by the end of the year that Onassis Foundation sponsored, and the president of the hospital also really championed it and make it happen. So, and it's Arik Finkelstein here, and maybe he can correct me, but I put this slide together to show that which is the challenge that we face. It's a challenge between accessibility of the patients to the new therapies. For instance, in this TAVI, we have similar countries in population: Greece, Israel, Austria, and Switzerland. Well, you can see here, Austria has the lowest TAVI centers in numbers, but every center is doing more procedures. So we have less accessibility maybe, but you have higher volume in this case. So, and Greece has the highest number of cath labs, but the lower number of cases per center. So this is an issue, and we have, of course, we have Poland, who has a very good structural program, very well conditioned DRGs, and very well kept and followed. So we have always a trade-off between experience and expertise and quality of care, because this go hand in hand with enhanced volumes, but on the other hand, you have accessibility issues. So in order to do that, in our center, in our hospital, we try to to increase the accessibility, but at the same time increase the volume in order to provide higher quality therapy for our patients, but also more economic, better economic results for the hospital, but also for the health payer. So we were dealing with several factors: the lab time, the coronary program, the imaging capacity, the CT, the echo capacity, and the ward bands, and of course the experience dispersion among the operators. And we tried to make, and we implemented 3 changes in the ladder. It's of course we tried to enhance the heart team meeting, and we tried to make changes in the cath lab. So we simplified the procedure, and we made, I think, very important changes because of we enrolled in the benchmark study and the fast TAVI study, and that gives us information in order to simplify the procedure and make it better for the patient and for the hospital. That had the result of decreasing the hospital stay, which went from 5.8 days in 2021 to 4.8, and then to 3.5, and last year to 3.3. And I presume we will go less than 3 days by the end of this year. Approximately 80% of selected patients are being discharged at 3 days in our hospital now, with after TAVI, and 42% at 2 days, despite being a self-expanding program in more than 95% of the population. So the future is almost here, and we anticipate by the end of the year the new ward with the new rooms and the hybrid rooms, and the newer capability that this has to offer. So thank you for being here, and I'm looking forward to the discussion in the next session. So we will discuss in what matters to patients, to what matters to physicians, to industry, and providers. So thank you very much, and I'm all ears to see what the discussion will bring. So thank you.
I think we're going to speak in English, right? Yes. So I think it was an excellent presentation of the problem. There are some issues I think we're going to discuss, but I would give first to the panelists and see what their opinion, and then I'll come back. I want Mr. Athanasiou to see what you can tell us about your opinion about why we cannot further develop this